Mama. Say hi, Mommy. Hi, Mommy. Ready? Peekaboo. What research has shown is that children with congenital heart defects are at a higher risk of developmental challenges than the general population. And so our program closely monitors children with congenital heart defects for developmental challenges. The CANDO program here at Children's National was started by Dr. Mary D'Onofrio, a cardiologist, and Dr. Jackie Sanz, a neuropsychologist, with the goal of addressing the developmental challenges associated with congenital heart defects.
For patients who are diagnosed prenatally, I actually enroll families before kids are born. What we can see in utero in specific congenital heart defects are flow disturbances that can be detected using ultrasound technology. This enables us to track how the heart is affecting the brain, how blood flow changes in specific congenital heart defects, and perhaps which babies are at an increased risk after they're born.
One of the strongest things about the CANDO program is the multidisciplinary aspect. By that I mean we don't have cardiology functioning in one lane and development in another and neurology in another. We have 4 or more providers in one room, seeing the same things, talking about the same concerns, not just saving parents time, but providing the specialists an opportunity to talk with each other about what they've seen, about what parents' concerns are, about what might be affecting the kid developmentally.
Stay at home with him, or do you see other babies?
¿Quién lo cuida?
Yo.
Usted. Muy bien. And at 4 months you can actually see a lot in terms of how a child is developing. At 4 months of age, children have a volitional reach. By that I mean infants will reach and grab an object and bring it to their mouth. Children are usually starting to roll over, if not all the way to their bellies, at least to their side. You can see a lot from a child at 4 months in terms of social development too, how watchful they are of people.
We'll do evaluations at key stress points in a child's development. Usually at bare minimum, this is when a child is beginning to get ready to go into kindergarten, at the transition from 3rd to 4th grade, which is where a child goes from learning to read and then transitions into reading to learn information, and then the transition to middle school, where they're juggling between multiple teachers and classes, and high school, again, that becomes more complicated. And at each of these stages, we'll evaluate a child's strengths, what they're really good at, and we'll look for any weaknesses that the child might be showing. So we would set up supports in their environment, make recommendations around school services and supports that might be appropriate for that particular child's issues, and then also make recommendations around particular interventions or therapies that might be helpful in remediating the problem.